Hi, and welcome to my short presentation today on molecular pharmacology and migraine. I'd like to start by saying ngā mihi nui. Thank you very much to everyone who supported me on my journey so far. So let's start by talking a little bit about pharmacology. What is pharmacology? This is the science of medicines and their effects on our bodies. Pharmacologists research and develop medicines. And molecular pharmacologists like myself study the molecular actions of the drugs that are the active ingredients within a medicine. Many of these drugs work via proteins called receptors. Receptors are found on the surface of cells, and there are about 1,000 of them in the body, each with their unique job to do. Each drug hijacks a specific receptor to produce a health benefit, and a really good example of this is drugs that treat asthma. So when you have an asthma attack, your airways close up and you find it difficult to breathe. Certain asthma drugs that you breathe in through an inhaler enter the lung tissue and bind to specific receptors for those asthma drugs, which create a chain reaction in a cell telling the airway to open up. Many other drugs work in this way, like drugs for blood pressure. And other drugs, major breakthroughs recently are for migraine, and that's what I'm going to spend the rest of my presentation talking about today. So migraine, we might think of it as a bad headache, but it's much more than that, and that's really important for us to all understand. Migraine is classified as a disabling headache disorder, but it also has complex symptoms. As this piece of migraine art illustrated by someone living with migraine shows. In addition to the severe headache, migraine is often characterized by nausea and vomiting, and high sensitivity to stimuli such as bright light, but also you can be more sensitive to smells and sounds. Migraine has considerable impact, not only on the individual, who will often have to go and lie down in a dark room in order to make it through an attack, but on their family, their ability to be educated, their ability to work, and collectively, this has a substantial impact on society. Especially given that around 15% of people live with migraine. And importantly, many of them have no effective treatment. Recently, we've gained important insights into a substance called CGRP, calcitonin gene-related peptide. This is a natural molecule which is found at sites important for pain, such as the trigeminal nerve. So the trigeminal nerve, shown here on this diagram in yellow, is the main nerve of the face and head that is important for transmitting pain. And the way in which it does this is through substances like CGRP. If we zoom into the trigeminal nerve, you can see here in purple individual nerve cells that contain this substance called CGRP. And this is released from those nerve cells to bind to CGRP receptors and to produce pain. And what we know is that in people living with migraine, this system, CGRP and CGRP receptors, seem to be overactive. So CGRP binds to the CGRP receptor on nerve cells, leading to migraine symptoms. And it seems that people with migraine have far too much of this CGRP receptor activity, leading to pain. We don't really understand why this is or how, but importantly, a new class of drugs have recently been developed that block these CGRP receptors to bring much needed relief to those living with migraine. So when a migraine patient takes one of these new drugs, the CGRP blocking drug binds to the CGRP receptor in place of CGRP, stopping this cascade of activity that produces the pain, essentially normalizing CGRP receptor activity. And for the first time, some patients have now achieved prevention of their migraine and acute treatment of their migraine that was never possible before. So this is a major advance. The new drugs are listed at the bottom. Iralimumab and galcanezumab are the two that are MedSafe approved for use in New Zealand, and hopefully before too long, the others will become available as well. Though life-changing for some patients, there's a lot more work for us to do. We don't actually understand how these new drugs work. Do they activate only that CGRP receptor, or do they have other molecular targets? Do they act inside the brain or outside of the brain? And can we better tailor therapies by targeting one site or another? Why are some patients super responders? And why do some not respond at all? To explain that a little bit more, what I mean by super responders is patients living with chronic migraine who've suffered from 15 or more headache days per month for most of their lives. They take one of these new drugs and their migraine has gone, or it's hugely diminished compared to normal. Others have not had any migraine relief at all from these new drugs. So is CGRP important in some patients but not others? Could these drugs be used for other conditions like cluster headache, another severe disabling headache disorder, or pain more generally? And a really important point is that many of these new drugs are expensive. So can we further refine them, fine-tune them, to make more affordable options to benefit more people living with migraine? And our molecular pharmacology research is helping to find those answers. Now, in my short presentation today, I don't have time to delve into that research, but what I do want to spend a few moments doing is outlining a few places where you can find out more. The Australia-New Zealand Headache Society has really important information for patients and information for clinicians. Migraine New Zealand is a patient advocacy forum which is helping to support people living with migraine in New Zealand. The American Migraine Foundation has a large number of fantastic resources for patients and clinicians alike. The Neurological Foundation of New Zealand also has some information, and for detailed information on these new CGRP drugs, cgrpforum.org also has useful information. And just to bring the presentation to a close, I want to say, let's work together to make it easier to live well with migraine. As individuals, let's talk to our family and friends who have migraine. Let's understand that. As employers, let's make it easier for and more flexible for people living with migraine to work more effectively. As a society, let's not create stigma. So let's work together to make it easier to live well with migraine. Thank you.